in order to examine the real-world treatment patterns and outcomes of a proteasome inhibitor and lenalidomide dexamethasone triplets by prior len exposure, we performed a retrospective cohort study using Optum's de-identified electronic health records database. And this is really a representative sample of a general US population with data from providers, clinics, and hospitals across all 50 states. And a comparative effectiveness analysis of time to next therapy, which we use as a proxy for progression-free survival in a representative cohort of patients with relapse refractory myeloma treated in the routine care setting with a proteasome RD backbone, including IRD, which is ixazomib lendex, KRD, carfilzomib lendex, or VRD, bortezomib lendex in second line of therapy or later was examined. And patients were categorized based on their exposure to lenalidomide in any line of therapy prior to this index line of therapy. So a total of 650 patients were included in this study, 397 of which had prior len exposure and 253 did not. And in terms of just baseline characteristics, I think it is important to mention that 48% of this population that was lenalidomide exposed were actually IMiD and or proteasome inhibitor refractory prior to the index line of therapy. So we did a few different analyses in an unadjusted Kaplan-Meier analyses looking at time to next therapy and regimen duration of therapy for VRD, KRD, and IRD based on prior len exposure. We found that in the len exposed population, there was no significant difference in the median time to next therapy by regimen type. We did find in patients with no prior len exposure that the time to next therapy was significantly longer for IRD versus KRD regimen.